The symptoms after COVID-19 are of course incredibly diverse, and we group them really into three groups. There's cognitive or thought process, there's psychological, including PTSD, and then of course the physical, the fatigue, the pain, the brain fog. There's no simple answer as to what causes these, and it's probably multifactorial. A lot of the cognitive and psychological symptoms after COVID can be explained by the fear with which we went into this pandemic. They can be explained if we've been in hospital by the loss of day-night pattern, the delirium it might have caused, and of course by the sedative drugs if we ended up on intensive care. But they don't explain all of those, and nor do they explain the physical symptoms. And the reality is that in COVID, the body's immune system goes into overdrive, and its coagulation or clotting system also goes into overdrive. That causes inflammation of nerves, inflammation of organs, which can swell, and it also causes cell death. And some of those cells in those organs, some of those nerve fibres, some muscle fibres will die. Those combination of effects will account for a lot of the physical symptoms after COVID, and also for some of the cognitive and psychological. And then a further cause is nutritional depletion, the fact that we might not have been eating properly and our body is crying out for the building blocks to help it to get better. So there's lots of causes for the symptoms, there's not a single one, but hopefully this helps us to understand a bit and know that the journey will take some time.